Okay, welcome everyone. Thank you for joining us today. I think we still have some folks filtering in from the waiting room. We're here for our second community forum for veteran oral health care, and we're focusing on care integration in Iowa. So welcome, and I'm going to give us an intro. We can head on to the next slide. A few housekeeping pieces. We are recording this session and we'll have the recording available afterwards on our website, along with the slides and other materials. Please chat and engage throughout. This is a community forum, and by that we mean we want to hear from you as well as sharing the data that we found through our research. So please share your information in the chat, say hello, and I hope you stay engaged there throughout our time here together today. CEUs are available for this session. You must attend the entire session to be available for those CEUs, and we'll provide the evaluation and request link for that at the end of the session. We can go to the next slide. These are our learning objectives here today. These were provided in the registration information and are attached to our CEUs. We can head on to the next slide. Our presenters do not have any disclosures to share today. And what we're going to talk about. So in just a few minutes, I'm going to hand it over to Annalise Cothran, our Executive Director at AIDPH. And she's going to be talking about the state of veteran oral health in Iowa and give an overview of the research we've done there, and then specifically dive into identifying integrated care opportunities for Iowa stakeholders. Through the report we've done, the in-depth report that we did on veteran oral health in Iowa, we've made several strategic recommendations, and today we're focusing on those associated around integrated care. And then most importantly, again, we want to hear from all of you on how we can leverage this report for collective action. So throughout Annalise's presentation, we're going to have several opportunities to pause for discussion and chat, as well as some polls and other opportunities to hear from you and your thoughts. We can head to the next slide. So what is a community forum? Again, I've mentioned this a few times. This is the second part of a 4-part series of virtual community forums we're doing. We're sharing out the information that we found from our in-depth report on veteran oral health in Iowa, but we also want to hear back from you of what you're seeing. Are there any other pieces that are missing? Success stories, and how you feel that we can use this data for collective action to improve veteran oral health in Iowa. This is, again, a 4-part series, and we're culminating with an in-person statewide summit in veteran oral health in Iowa in August. And the information that we gather during these virtual sessions will inform the agenda that we set for our collaboration in that session. And we'll talk a bit more about that later. We can head on. So before I hand it over to Annalise, I'm going to talk a little bit about AIDPH if you're not familiar with us. We're a 501c3 nonprofit, and our mission is to empower our community to advance oral health through science, education, and advocacy, with a vision of working towards a justice-oriented oral health system. And within that work, we have 4 communities of focus. These are communities that have been historically excluded and underserved, particularly when it comes to oral health. And those communities include LGBTQIA plus people, veterans, people with disabilities, and people living in rural communities. And we also recognize that there is, of course, intersectionality amongst these communities. At AIDPH, a large part of our programming is educational programming, like what we're doing here today. And this graphic is a great visualization of what we offer. We try to offer a diverse set of opportunities for educational programming, so there's really something for everyone at every point of kind of time and opportunity that you have for those professional developments. We have workshops and webinars, learning collaboratives, certificate programs, which are more focused on a set curriculum pathway, fellowships, which again are more intensive application-based programming, and we culminate in our colloquium, which is our annual in-person conference. Can I head to the next slide? We also want to highlight that we have a resource hub for this report, as well as the information gathered through these community forums, and that can be found on our website. We'll post a link in the chat to our Iowa Veteran Oral Health page as well, so everyone can access those resources. You can head to the next slide. So without further ado, I'm going to hand it over to Annalise Cothran to talk a little bit more about our data and the state of veteran oral health.
Thanks, Liz, and hi, everyone. Welcome. Thank you so much for joining us today for this community forum. This is the second in a series of 4 in which we're highlighting specific topics around veteran oral health in Iowa, ultimately culminating, as Liz mentioned, in a strategic planning session in August in Des Moines. And so I just want to name that again so that everyone kind of stays on the same page and feels aligned with our overarching goal here, which is to, yes, of course, disseminate this report and have everybody feel familiar with it, but also for folks to get an understanding of where their work is in relation to veteran oral health and how they can use the recommendations and the data presented here in this report to stimulate their work, support their work, or add to their work. Which is why we wanted to start in the very beginning here. We've, as Liz already mentioned, put some engagement points throughout. And so we'd really like to just hear back from you right now about your particular interest in veteran oral health, what drew you to this community forum, and why you felt like maybe this report or this information would help stimulate your work. So throw that information into the chat. And as people are thinking about that, I'm going to take us through the next few slides, which really is an overview of the state of veteran oral health in Iowa, but also an overview of how this report was developed. So as you're responding to the question about your interest in veteran oral health, to give an overview, and if you came to the first community forum, this might be repeated information, but for those of you who are new, AIDPH was funded by Delta Dental of Iowa to develop this report on veteran oral health. And really, it was designed to be almost like a state of the state on veteran oral health. It was a pretty rigorous process of identifying data, some data collection through qualitative interviews, and then also developing this really comprehensive report. I hope everybody's had the ability to click on the link and look through it because it's about 74 pages. So we developed all the text, compiled all the findings, and designed it in a way that we thought could be visually compelling and digestible, given how comprehensive this report is. And that report was released in January of this year. And so we've really been spending since January forward, spending all of our time amplifying the findings, recognizing this was such a large report and that people needed time to digest it, to understand it. And part of what we're doing in these community forums is chunking out particular aspects of this report. So through this report, we really wanted to understand 4 different things, which was how do outcomes differ in Iowa between veterans and non-veterans? What factors are contributing to poor oral health outcomes among veterans in Iowa? What opportunities exist for improving those outcomes? And lastly, and most importantly, what can we do? What steps can be taken to impact and influence those outcomes? So we first started with a literature review, meaning we really wanted to understand what had already been published around veterans in Iowa and their oral health, their overall health. And that's where we started, was really orienting ourselves to what veteran oral health is and what it looks like in Iowa. From there, we gathered data, quantitative data, and we analyzed those data predominantly within the behavioral risk factor surveillance system, or PURPOSE, and a couple of other data sets that are also reflected in the report. The third aspect that we did was stakeholder interviews. So we sent out a pretty broad, cast a wide net to get an understanding from providers and patients and veterans about what their experiences were with oral health in Iowa. And then lastly, we took all of those things and created recommendations by stakeholder to improve veteran oral health in Iowa. So I'm pausing here to see, in alignment with our stakeholder interviews and really wanting to ensure that we're pulling in stakeholder feedback. I'm just looking through the chat here to see what interests you about veteran oral health. So I'm seeing increasing access to care through Medicaid, and so some policy implications. Thanks for sharing that, Josh. And we want to give our first community forum a review where we talked about different policy opportunities. Carol mentioned that she is supporting low-income veterans through the Iowa Veterans Trust Fund, which is a fantastic resource. We'll definitely talk about that today. And we did talk about that in our first community forum. I see Haley has some personal experiences related to being a veteran and a spouse. So I appreciate you being here today. Seeing other folks really just leaning into improving access to oral health care, which is wonderful because I think that the findings in this report really meet the needs and interests of what you've reflected here today. So I can't wait to get into that. For this report, we have a few different elements with the intention of really trying to expand how people use this report and really lean into the findings of it. So as you probably have there in front of you, a really large, comprehensive, very technical report, still visually engaging. But we also have an executive summary. We actually have two executive summaries. One is about 7 pages. It's a little bit longer, has a little bit more information. Then we have a 2-page really quick high-level overview executive summary. And lastly, we have our data dashboard so that you can go in and actually interact with the data on your own. And so each one of these pieces support different sections within the ultimate report. And we're going to go through today, we're really going to highlight sections 2 and 3, so the oral health pieces and the overall health pieces, since we're going to be talking about care integration. And we're also going to talk a lot about what the recommendations are and how we can apply that in our daily work here. So this report was designed for a series of stakeholders, and we're really interested in knowing among these stakeholders and target audiences, which you identify with. And so I think we're launching a poll. Thank you. We are launching a poll. So we talked to these stakeholders in our report and calling attention to use cases under each one of these target audiences. And also, we created strategic recommendations based on these target audiences with our intention of having this be a very usable report that doesn't sit on a shelf, but really has implications for real world activities and programs. So I'm just giving everybody a second to respond here. So I see almost everyone has responded, but not just yet. So I'm going to give everybody 3 more seconds. Okay. So I'm going to end the poll and share the results. It looks like most of you identify as either a researcher or a veteran caregiver, which is really exciting. Again, thank you so much for being here. And I feel like you'll find a lot of value as a veteran caregiver, family member, researcher, or other clinical stakeholder in what we'll be reviewing today. Okay. So let's talk a little bit about the infrastructure. And I'm not going to spend a ton of time here because I think probably based on your responses, this might be something you already know about or understand or live and work in on a daily basis. So the best place to start is, what does veteran oral health look like nationally? What does the infrastructure for veterans look like nationally? And we actually start with this in every presentation that we do about veterans. And you may have heard this information a million times at this point. But what I find is that everybody tends to be, at least one person in these presentations tends to be really surprised by this information, which is that of the 18 million veterans in the US, most of them are not getting care through the VA. So if you look at this visual representation, all of those people up at the top represent a veteran, and about half of them are eligible to get medical care through the VA. So that would be that slightly darker blue here on the left side. So those 9 million veterans are able, through congressional mandate and the federal code are able to go get medical care in a VA clinic. Unfortunately, about 80% of those veterans who walk into those dental clinics because they're eligible for medical care, they walk out of those clinics with an unmet dental need potentially because they are ineligible to get dental care. And so, really, what that ultimately means is that most of those veterans in the US are not getting dental care in the VA, and only about a third of them that are eligible are utilizing that care. So, what that might mean as a stakeholder in Iowa is that as a private practice clinician, as someone working in an FQHC, et cetera, basically anyone providing clinical services outside of the VA, you are far more likely to be caring for a veteran versus a VA dentist or a VA clinician, simply because the eligibility is so limited. So, thinking through where veterans are getting their care, that answer is really complicated. Um, we know that there are only two dental clinics in Iowa. So, veterans who might be living in a more rural area or more rural county would, if they are eligible, if they're part of that 20% that are eligible for dental care, they're having to travel longer distances to be able to get to a VA dental clinic. And like veterans, like many Iowans, are living in health professional shortage areas, both medically but also dentally. So we know that that tends to complicate when we know there's low eligibility and you're not able to access dental care through a VA. We also know that the workforce in Iowa is just simply strained because of these health professional shortage areas and these dentally underserved counties. We also understand, and this came up again multiple times in our stakeholder interviews, that rural veterans are experiencing a disproportionately difficult time accessing care because, again, there are few dentists available in rural areas. The VA dental clinics are located in urban areas. And we also know that Iowa has a highly rural population. And in fact, many of these counties have disabled veterans who really need more complicated or complex care associated with their needs. And we'll talk about that a little bit as we get into the care integration discussion. So, Liz, I'll turn it over to you.
Okay, great. Thank you. And thank you so much, everyone, for engaging in the chat so far. It's been really lovely to hear everyone's interest area and already some great content happening. So next, we would love to hear more about what you have noticed about the Iowa care infrastructure in your daily work. So we just got an overview of what it looks like systematically and from those interviews that Annalise referenced that we did, but we want to hear what you're seeing. And from what we've already seen in the chat, I know that there's personal and professional experience here from clinicians to public health folks. So I think that can really provide some diversity of thought and some diversity of perspective. So even if you're seeing exactly what Annalise just outlined, please share that. If you're seeing something different, please definitely share that. We want to hear what aligns and what is different. So we'll give some folks some time there. And Annalise, do you want to go over next slides and we can chime in with some answers? Does that work?
Let's do that. So, as folks are thinking about what you may have noticed or observed or experienced about the Iowa care infrastructure, the main things that AIDPH took away as we were reviewing the data and looking through this topic kind of importantly and deliberately. One, which I've already alluded to, veterans are disproportionately white and male and living in rural areas. That's not specific to Iowa. That's the pretty typical veteran demographic nationally. But in particular to Iowa, we know that there are more rural veterans in Iowa compared to other places in the country. This report also highlighted that Iowa veterans are experiencing high rates of poverty and housing insecurity, and we have some good resources listed in that report for you to explore further. And also, there are few dental health care access points because this very limited eligibility is also complicated by these medically underserved areas and very few VA clinics. It really means that dental care coverage is limited and that access is ultimately complicated. So the full scope of veteran access within this infrastructure is difficult to determine. Unfortunately, there are very limited data available for us to fully assess where veterans are going, how long they have to wait to get care, and what ultimately those individual barriers that they may be experiencing, what those look like. So, if there are pieces of information that you feel through your lived experience, through your observations, that would be helpful for us to support these key takeaways, we'd love to hear about that in the chat.
And I know some folks were before it took a few minutes to get the responses. I think folks were really putting together some longer, more thoughtful pieces. So I think that's probably the case now. I am interested, if I'm not putting you too much on the spot, Carol, you had referenced earlier working with the trust fund on your personal work. And if you're willing to come off mute and share a little bit more about that and how you see that playing into the infrastructure, we'd love to hear from you.
So yeah, thank you, Liz. It has been a game changer, and I was just trying to type in the chat about just the fact that prior to the trust fund going to that lifetime maximum benefit, it used to be only a certain. It was around 2,000 a year prior to the 10,000 lifetime maximum. And honestly, I didn't know a whole lot about it until just before it went up. But what I did was here in Scott County, I had reached out to um, several dentists and just got a very overwhelming, generous response from my dentists who were willing to care for veterans that really needed it. But obviously, that's not sustainable for a whole population of veterans. But it was really heartwarming and wonderful to get that response. But with the lifetime maximum, it's just amazing to see what veterans can do with that. Most of them are in high need, lots of needs, and um, you know, it, it's just great. And some veterans need way more than that 10,000 realistically for even for function. And I've had dentists just donate the difference because they felt strongly that what they needed was going to get them better function and whatnot. It's just really great. I don't know. I can't say enough good about it. I know Amber Cook is on the call as well. She's another silver coordinator in the Webster County area, and she's worked with it a lot as well. And the stories are amazing uh, with the work that's being done, and the dentists who are generous enough to, in a sense, be in competition with another dentist to get that treatment plan, because we have to have two dentists provide treatment plans, which I feel very uncomfortable with as a navigator. But the dentists that I work with here are just very willing and honestly just want the veteran to get the care that they need. So it's been wonderful. Yeah.
Thank you so much for being willing to be called upon and come off camera and share that, Carol. It's really helpful. Thank you. Annalise, oh, sorry, go ahead.
Well, I was going to say, Carol, I think you've really highlighted a couple of different things that were also mirrored in this report, which is access is complicated. And you know that firsthand being a navigator, and that what often makes that access even more complex is whether or not there's coverage available.
Mhm.
And then on top of that, we're layering social factors like poverty and housing and security, which again, that's all highlighted here through this report. So I also appreciate you recognizing that there are some solutions available. There are bright spots like the Iowa Veteran Trust Fund. And we did talk about that in our last community forum. It's a really effective policy solution that AIDPH is actually supported nationally for other states to look at Iowa as really a best practice and policy solution. So I certainly appreciate you highlighting that, Carol, and really lending that personal experience to all of these data. So keeping our discussion going around integrated care, for us to really think through potential integrated care solutions or considerations, we really want to understand what the physical health of veterans look like. So AIDPH, through this report, examined data around physical health indicators and oral health indicators. And this is important because we know that certain pieces of our physical and overall health can exacerbate our oral health and vice versa. So, this is a really great graphic representation of how these different physical health indicators and aspects of our total health can then influence and impact both physically, but also financially, which we'll talk about too, relative to our oral health. And in fact, AIDPH has published on this nationally. These are not Iowa data, these are national data, and kind of examining what these chronic health conditions, what they look like, and how veterans experience them disproportionately compared to non-veterans. So overall, veterans have more chronic disease conditions compared to non-veterans. And even when we're controlling for other factors like rurality and income and education, veterans still experience these chronic disease conditions at a higher rate, and that is connected to their military service. So we understand there's a very clear kind of connection here between veterans and chronic disease conditions as a function of their military service. And what we've also recognized is that access alone doesn't solve these issues. So the graphic that you're seeing here, the table that you're seeing here, chart rather, that's not a table. We actually examined veterans with chronic disease conditions like diabetes and heart disease, and whether or not they've had a dental visit in the past year. And these are data that are pulled from the behavior risk factor surveillance system. And so we saw that veterans with diabetes and heart disease actually did have higher rates of dental visits in the last year. However, we also saw that they had more profound oral health outcomes, such as losing all of your permanent teeth compared to non-veterans with those chronic disease conditions, meaning access isn't the only issue or the only thing impacting these oral health outcomes. And in fact, like I mentioned, even controlling for other factors like income and education and rurality, veterans with diabetes were 40% more likely to be edentulous compared to veterans without diabetes, and 30% more likely to be edentulous than veterans without heart disease. And some of the data that AIDPH has looked at nationally to inform policy solutions, we know that these are high risk, high cost considerations for veterans, including veterans in Iowa. And in fact, by being able to manage chronic disease conditions and oral health issues in the same system and in the same treatment plan, it actually saves money. So for every dollar spent on providing dental care to veterans with diabetes, it's $1 saved on the medical outcomes or medical treatment. For heart disease, it's all the way up to $2 saved for every dollar spent. So again, these are really high cost issues that impact the oral health outcomes of veterans. But we also understand that treating veterans in an integrated system ultimately leads to a cost savings because we're considering the whole veteran and whole body health. So specific to Iowa, we did look at some of these chronic disease conditions and looked at exacerbating factors like rurality on oral health outcomes. So we saw that veterans did have higher rates of chronic disease conditions, both diabetes and heart disease compared to non-veterans. So again, in Iowa, those trends were consistent with what we've seen nationally, but also that rural veterans were experiencing these chronic disease conditions at a higher prevalence rate than non-rural veterans. So rurality was really complicating these disease conditions and prevalence rates for veterans in Iowa. Looking at self-reported physical health readings for veterans compared to non-veterans in Iowa, I want to draw attention to the blue bar because that's veterans, and then also the second kind of right side of this chart, which is veterans rating their overall health, their physical health as being good, fair, or poor. And so in each one of those categories, veterans have a higher prevalence of rating their physical health as good or fair or poor compared to non-veterans. So we know that veterans are not feeling as physically healthy in Iowa as non-veterans. So applying those same kind of logic pieces and those same kind of data analysis to a cost savings solution for veterans in Iowa. Again, recognizing that veterans are paying more out of pocket than compared to non-veterans. Veterans are experiencing chronic disease conditions at a higher rate compared to non-veterans, and that veterans are unable to access dental care in this integrated system through the VA. If those things were to be resolved, if we were to be able to give veterans integrated care treatments in these systems where we're managing chronic disease conditions and oral health in the same place, that we can actually save millions of dollars, up to $100 million of those medical cost savings through more effectively managed dental care. So hearing all of that, Liz, I'll turn it back over to you.
Okay, great. I hope everyone's getting ready. I see some pieces. Actually, I'm going to pause. There's a question, I think, from Josh here, so I'm going to read that first. So Josh is saying, are the 55 million and 66 million the cost to healthcare system generally? And if so, can we get the total cost to the state?
That is such a great question. So those are general costs specific to the medical cost savings through effective oral health. So these are pulled from Cigna Healthcare, who actually did a really big and very comprehensive study several years ago. I think it was 2015 was the magic date, but I could be wrong about that, where they examined their beneficiary data and looked at how much money they saved on the medical side for managing stroke, heart disease, and diabetes by giving their beneficiaries dental care. So who gets to benefit from those cost savings is a little bit relative to where veterans are getting their primary care, right? So we know that some veterans are eligible for VA care, some veterans are in Medicare, some veterans are in Medicaid, and all of those data weren't readily available to us to actually access where those cost savings were from. But in general, we know that when veterans are getting access to dental care, and the big piece of this is utilizing those dental benefits, that cost savings for those high risk veterans with those chronic disease conditions are pretty substantial. So I would say I would love to get more data on how many veterans are in Medicaid and accessing Medicaid, and what those cost savings could be. So thinking through those policy solutions and the Iowa Veteran Trust Fund, we could probably create some implications there. We just haven't been able to access those data. Open to any ideas there on how we could potentially apply this algorithm other places.
That's what I was going to say, the same, Annalise. I know that there were some pieces up front about the intersection of Medicaid and veteran oral health. So if folks have personal experience there or want to share ideas for approaching getting the data, let us know. And also to Josh's question, if there are questions outside of what we're posing, please pop those in the chat too. Or again, this is an interactive discussion, so we're happy to pause and get those questions answered. So thank you very much for Josh for sharing that. We can now look at our next question we're going to pose to all of you. So I hope you're getting your keyboard ready. And we're wondering what surprised you about all of the pieces that Annalise just spoke about. I think she mentioned at the beginning of her presentation, we always find that there's at least a few folks who were unaware of the state of veteran oral health nationally and often particularly in their community. So are there pieces that were particularly surprising to you that you didn't know about or not? Are there pieces that are reinforcing what you're seeing in your daily work? We'd love to hear a bit about that. So please share away in the chat. And Annalise, I will pass it over to you while folks think through that and share if you want to share slides or if you want to pause.
Yes, so I just want to note I'm keeping an eye on the chat too. So I'm really interested in hearing your results and if there's a place for us to interject any of that throughout the presentation, recognizing that this is supposed to be a community forum and we certainly want your feedback. I'm happy to pause as we move through the next section, which is an overview specific to oral health. So again, right at the very front of this, before I review the next few slides, I want to note, and something that we ran into quite a bit that we were really open about in this report is that there are so few data available and so few data sources available examining the cross-section of Iowa plus veterans plus oral health. So while the data are a little bit limited when it comes to oral health indicators, we were still able to draw insights and recognizing that some of those qualitative interviews helped us so much to understand the context around these data and also help us collect data that really just wasn't otherwise available. So we'll highlight there in this section. So in general, when we looked at that access to care question, we saw that veterans compared to non-veterans access or see a dentist less frequently. And in fact, 16% of veterans, again, this is data pulled from Burfus, 16% of veterans had gone more than 5 years without seeing a dentist. That's really substantial, especially when we're looking at the layers of chronic disease conditions and knowing that this is a situation where they continue to exacerbate each other with going so long with an unmet dental need and also having a chronic disease condition can create those really costly oral health outcomes. And unfortunately, we also understand or observed in these data that tooth loss was much higher in veterans compared to non-veterans. And in fact, 10% of veterans in Iowa had lost all of their natural teeth, and that this effect was actually compounded when we looked at rural veterans versus urban veterans. So really across the board, rural veterans taken together had more profound oral health issues and outcomes compared to non-rural veterans. And this was really reinforced in our stakeholder interviews. Almost every stakeholder from a variety of different backgrounds, including clinicians and associations and researchers and veteran caregivers, we recognize that through these diverse backgrounds, that rural was a very common theme throughout all of those experiences and perspectives, that rural veterans, as a function of where they live, really struggle to access dental care, and that geographic barriers compounded by things like poverty and other social factors and economic and structural factors create really complex care needs for veterans living in rural areas of Iowa. As we've already reiterated, being able to afford dental care is a really big issue. And that's not just for veterans, and it's not just for Iowa veterans. We understand that cost of care is high for all Americans, and so it certainly doesn't mean that Iowa veterans are immune to that issue. Solutions like the Iowa Veterans Trust Fund have really helped with affordability, which is why we really like to highlight the trust fund as a best practice policy solution across the other states that we work with. And in fact, there are other states who've been really excited about seeing that Iowa is leading and sort of championing this affordability issue through policy solutions like the trust fund. And so taken together here, again, I don't think this is probably news to anybody. It does follow national trends in our national work, and that looking at Iowa veterans, veterans compared to non-veterans in Iowa did have poorer oral health outcomes, and that there were issues like income and rurality and education and age that certainly widen those disparities. However, rurality was one of the biggest indicators of disparate oral health outcomes between veterans and non-veterans, and even within rural and urban veterans. And so lastly, one of our biggest takeaways is not just about access to care, but also the ability to really drive those optimal oral health outcomes. And we surmise that it's because of this interaction between these chronic disease conditions that we also know are much higher in the veteran population, and the impact on oral health outcomes that we've recognized and observed in the data, which taken together really necessitate an integrated care approach, which is why we're here today to really facilitate some of those ideas and solutions and recommendations.
I just want to, we have this next question here, but I want to share some of the pieces that have been going on in the chat. Annalise, you were just talking about cost, and that was one of the pieces that Amber called out was dental care costing more for veterans and non-veterans on average was a surprising piece. And also Edith was sharing erroneously assuming all veterans had dental coverage via the VA. And I was just commenting there that that's a piece that we see. We have the privilege of having this data and sharing it out with folks as a main part of our programming. So we're having these conversations often, and that's a thing that comes up over and over again, almost every single time. I would venture to say, Annalise, that we're talking about veteran oral health with a group of folks, is that that same point comes up. And I highlight that to, one, say you're not alone in that assumption, but also it's why participating in pieces like this is so important. And I just would call upon all of you, if there's pieces that were surprising to you, particularly around the access and the eligibility, to please share that out with your communities and with your colleagues, and kind of share this information out, because people probably have the same perceptions, and it's important to start off from that. The access care is a big piece of that. So thank you all for sharing on those pieces. And if there's something else that's occurring to you about the surprising factor, you can always go back to that. We're going to call out another question we'd like you to think about. And that is, what other oral health barriers have you observed or encountered? Again, this is both professionally or personally. I know we have folks who kind of fit into both categories, people who are veterans, people who have spouses who are veterans on this call, as well as people who are providers. This is an incredibly important question for us to hear from the community, from all of you who are on the ground doing this work as oral health stakeholders in the state. So please share away on this barrier piece as we go over the next slide, and we'll pause for sharing again.
Yeah, Liz, I'll share one thing that I learned through these interviews, which I did all of them personally, which was so helpful for me to hear directly from folks living in Iowa and invested in making veteran oral health better in Iowa. One thing that came up a lot during these oral health barriers, but also just generally, and it was a little bit tied to rurality, which was transportation. That was one of the biggest things that, aside from rurality, was mentioned across the board, particularly among older veterans. who really needed more culturally affirming care, who needed caregivers to attend with them, who may not be able to drive independently. And it was a really complicating factor. So I would love to hear anything else in the chat if folks have another oral health barrier that maybe wasn't captured somewhere in the report, or even just have some additional information on some of those barriers that we were able to capture and observe from the folks who chatted with us to inform the recommendations and solutions here. So, as I mentioned, those stakeholder areas that we saw at the very beginning, our intention was to create recommendations related to those stakeholders. And today we're going to focus on what these data led us to create recommendations for in relation to integrated care for veterans in Iowa. And so number one is investing in community health centers as that critical access point for veterans. We know, again, thinking through rurality and how so many rural health centers are closing nationally. This is a trend everywhere. It's certainly not specific to Iowa, but it is happening in Iowa. And that FQHCs in general, as part of the safety net solution, are potentially struggling, or they're located in dental HIPSAs without an effective workforce. And we know that these are really critical access points for veterans, but also all Iowans. And so just in general, we know that FQHCs are actually uniquely positioned to support care integration because they often have co-located care. They often have health systems and treatment planning aspects that are integrated naturally as part of the work of an FQHC. So we know that these are really good access points and also just care delivery models for stimulating integrated care. To that effect, interprofessional care teams really should be considering opportunities to integrate treatment planning. And again, I want to highlight here that we know the medical cost, like on the medical side, is where we observe those cost savings. So by more effective oral health care access, utilization, and treatment, particularly among veterans who have those chronic disease conditions, we know that the medical cost savings are substantial. So there really is a financial investment, an incentive to be able to do this higher level of interprofessional care delivery and also treatment planning when considering oral health and in particular those chronic disease conditions that have a bidirectional relationship with oral health outcomes. We also want to highlight the opportunity to consider non-traditional stakeholder collaboration in this integrated care environment. And some of those have already been discussed here, like Carol mentioned, how some clinicians already sort of step up and create that pro bono care, how they're more than willing to support veterans. But we also know that these non-traditional partnerships can really drive creative solutions that address disparities. And we've seen them highlighted in this report and throughout Iowa. And more importantly, we know that this can drive systems change. It's really leveraging these different types of stakeholders. It's not just an individual level or treating an individual veteran, but really creating a network and an infrastructure of these types of businesses and faith traditions and partners and FQHCs working in collaboration with private practices and the community care network. We know that working together really helps fix those medical issues and dental issues, but also social issues and structural issues and economic issues that often mean whole person solutions and whole veteran solutions are a result.
And
Oh,
Annalise,
go
you
ahead,
know,
Liz.
I think you're moving into this, but I just want to call out, I'm sure you've seen in the chat here, Josh was commenting, one of the barriers being the healthcare workforce shortage there, and that being an opportunity. We have educational institutions that can be a pathway to talking through those. And I think you're going to go into health workers and increasing that piece. So I just wanted to call that out as you move into those topics.
Yeah, thank you, Liz. I feel like that's really important to consider how the workforce in general, as part of this integrated care approach, to include community members as lay health workers, but also more effectively utilizing the entire health workforce and oral health workforce to meet the unique needs of veterans is a really critical call out. So thanks, Josh. I appreciate that. And that may also mean that we're looking at opportunities for each member of the oral health workforce to be working at the top of their scope and licensure, and in a way that's really clinically supporting the complex care needs of veterans in Iowa. And lastly, I actually like to put this in as the number one kind of incremental step forward for addressing veteran oral health and healthcare broadly, which is just ensuring veteran status is on your clinical paperwork. I cannot count how many times I've spoken to someone who works at an FQHC, or who works at a private dental practice, and this question isn't routinely asked on intake paperwork. And a way to facilitate care integration and really a holistic treatment approach is to assess if the person sitting in front of you is a veteran. And I specifically put a woman here because I've talked to so many women veterans who have said, nobody's ever asked me, have you served? Because the assumption is, since most veterans are men, that women are not kind of routinely asked that question. And so just starting there, and it doesn't cost any money, it doesn't require legislative change. It's a very, very easy solution to just going through that triaging and assessing the needs of those veterans, to include chronic health conditions, to include oral health issues. But starting with adding that to your paperwork so you can even begin to triage some of these integrated care needs is a step one that you can make that change even today. And so with that, we would love to get into our next poll, which is, of these recommendations, what do you feel is the most actionable for you and in your daily work? But also, I would like to say, if there's another recommendation that we haven't thought of that maybe stimulated your interest as part of this discussion, we'd love to hear more about that in the chat. So please respond to the poll about what you feel like is actionable, but also if there's something that we may have missed, or even something that you're already doing to facilitate care integration of Iowa veterans, we'd love to hear more about that too. And Liz, I was just, I was pausing to make sure that I captured anything in the chat, but also I'll leave the reflections and share outs to you.
Okay, great. And I'm wondering if y'all will allow me to do one more call out. Haley, you shared at the top of the call about your personal experience and also being as a provider and wanting to understand how you can be a resource to veterans. And I'm just wondering if there's any pieces here that resonate with you as actionable pathways forward. If you're able to come off and don't mind too much with me calling you out, I'd love to hear from you.
Sure. Well, thank you for the call out. Actually, I learned a little bit more, and I want to do a deeper dive in understanding better about the Iowa Veteran Trust Fund and how we maybe can assist families of veterans access that. So I'm going to have to, I was actually Googling it because that's a resource that I was not aware of. I just know for me at Broad Arms Medical Center that we see a lot of veterans, so the ability to add "Are you a veteran" onto paperwork is important, and I think we would do that. So that's a takeaway. So, but we do see a number of them, and I can't recall if I'm flagged by that just in conversation, but I want to make sure that it's more overt on our paperwork. But what the stories that we hear most often is that the veterans seek care through the VA system for everything except for oral health, because of the if their oral health did not decline as part of line of duty or line of service, it's not a covered benefit, and that's just been the challenge. And I was hoping to get a little bit more insight on how, or learn, has any of that changed? Is there something that we can be doing to advocate for that change, to legislators or stakeholders, or, so that's where I am. So I don't know that I've answered your question, but that's what I want to share.
That's fantastic. Thank you so much. And again, I really appreciate those of you who have come on camera and spoken and allowed me to call on you. I think it's really helpful to the community discussion and hearing your thoughts. That's great, Haley. And I think something that I say when we're talking about policy and advocacy, those things can seem intimidating and they seem really big and over here with federal policy pieces, but it starts at the local level of, again, even just sharing this information out, and like we were saying before, sharing with your colleagues and ensuring everyone understands kind of the where we are with access for veteran oral health and what the eligibility pieces are. It starts there. Also educating your local legislators. It kind of trickles up. If they understand what the state of affairs are, they may or may not, depending on their background and depending on their policy focus areas. So don't feel intimidated. Share out, share broadly. Education is a major part of moving change forward and participating in these. And I would also encourage everyone to continue coming to these series. Again, this is our session 2 of a 4-part series, and then we're coming to Des Moines and we're having an in-person summit. We'll also have a virtual portion of that, and that will really be a strategic planning session of what we can do collectively to take action on next steps to kind of change some of the access pieces. So please continue to participate. I also want to say that what you've shared in the chat here isn't just for this session. We will be kind of summarizing and sharing that out. So it really is impactful, you're sharing here today. So I appreciate that. Annalise, I'm just going to flag, I can't see the poll results on my end, and I'm not sure what's happening technically, but I want to flag that if you want to be able to share those.
Yeah, it looks like number 1 was adding veteran status to intake paperwork at 60%, which is awesome because that's such an actionable, easy change. But again, isn't high cost or high capacity. And then 30% of folks indicated that investing in community health centers and really building out that infrastructure felt like a really actionable change, which is amazing. So as Liz mentioned, these are the kinds of things that we'll be adding to our strategic planning session and summit in Des Moines in August. And then Liz, I'll just hand it over to you to just briefly close us out. After I'm hearing some folks here that says, that these feel actionable and that they're glad they got to attend. So thank you so much for coming. You have the ability to use this report right now. Liz has already mentioned a couple of ways to do that, which is through education and advocacy, and really identifying your stakeholders. But a lot of you are doing this work in veteran oral health every day. And so we're hoping that this can help you in that decision-making process through evidence-based recommendations and solutions, understanding this data, hearing this data, and figuring out ways that you can apply it, but also further that work through seeking funding. We just want to note that Delta Dental of Iowa has a vested interest in supporting veteran oral health in Iowa, and that many of you just may want to consider that funding opportunity, and knowing that as you find places in this report where you're doing that work or you can expand your work, that there are some local funding opportunities that may help you with that.
Thank you, Annalise. And to that point, I would say please stay in touch. Again, please join us in Des Moines. Please join us on our next 2 virtual sessions. We will follow up with an email sharing out the information from this session. It will be posted on our website. We hope in addition to reviewing it, you share it with colleagues, share it with your network. We don't have registration open for our session in Des Moines, but we do have an interest form. And so once we have registration open with all the exact details of the location, etc., we will email out folks who have filled out that interest form. So if you're interested in registering, please fill that out. We'll capture your information and stay in touch. And I'll also say we're always available for questions in between these sessions. So please reach out to any of us at AIDPH with any questions or feedback you have in between these sessions. And I think, do we have a next slide? So we're also going to post our CEU link in the chat here. I think Annalise already did that. And in addition to the CEU request information, we have an evaluation tied to that. So please fill that out. It's incredibly important to us to understand how helpful this was, or if there's improvement areas, we can tailor these sessions so that they fit the community needs. So even if you don't want CEUs today, please fill that evaluation out. It's incredibly helpful to us, and we appreciate your time there. Again, CEUs are available, and if you attended the entire session, you can fill out that request form and we will process that for you in the next few days. We posted the link for the summit interest form. The recording and the summary information will be on our website shortly. And also you can register for the next session. I think we'll pop that registration link in the chat as well. So again, thank you everyone for your time, your engagement. The point of these sessions are to hear from you and work with you at the community level. So we really appreciate your time and engagement, and we hope everyone has a wonderful rest of your day.